time after real time to get the sequence. That's how much of this was there and all of that. What's the dominant variant now? Because we started out with the Eta and Alpha, and then, it's gone on to Delta now came into the mix in the third wave, and then who's what will happen in the fourth wave. But if we even move away from Omicron, because it can be distracting, there was already a wave brewing. It's already a wave brewing in Europe, pre-Omicron, that is not Omicron. And I think what Nigeria should be looking at is the fact that once Europe goes in, we come in after. Yeah. And so we're looking at Christmas coming in, the holidays and all of that, and therefore rising from, like we did in December of last year, going into the holiday and rising from it with a huge wave, because that was our tallest wave. The second wave, we had the highest number of cases. The third wave had the most severe cases, higher number of deaths, if you like, but the second wave had a higher number of cases. Yeah, and it was shorter, sadly. Interestingly, it was shorter in terms of the span. But that's what I'm talking about here. So we should not distract ourselves with Omicron and really be looking at the fact that there's a brewing wave already, there's already brewing, still brewing, and Omicron may be irrelevant to that wave. And that's what we should be looking at. And that we are still playing significant catch-up with the perhaps most important defense, which is widespread vaccination. Crazy that we are still in single digits. It's unbelievable. Unbelievable. Yes, because Africa averagely is already at 18-19%. South Africa has pushed into the 20s. So why are we that far behind? And where's that emergency? If something is a real problem, you're almost like, this is the number one priority for the government, if you like, and all other leaders of thought and organizations and all of that. Where's that emergency? Where's that everything goes down to this? And the funny thing is that we actually have vaccines in country. So there are vaccines in country. What is going on? I swear.
Interesting that, we're here now. Tomorrow is December 1st, and the federal government has said that federal civil servants that are not vaccinated won't, be allowed to work. How do you think that will go?
So I think you must first understand the principles around this. While I'm not a big fan of mandates, I clearly believe that the single biggest lever that would move us to higher levels of vaccination is mandates. If you feel you cannot access you can go to your workplace, for example, and if they can get around the legalese, to understand if it's legal and all of that, you saw with Obaseki in Edo how much of a furore that led to. But the point is that it's not about militarizing that thing or saying don't. It's actually like, Niger, just put this thing, you can't get this without this, and everybody rushes to get it. Because a good number of us may not have thought it through as to why we are not taking the vaccines. But just be that, there are people, I'm part of an enhanced vaccine access program where you actually take vaccines to people's doorsteps and then try and do that. And it has
the way they do the children
polio, like the polio one.
So door to door, school to school.
Or you go, or to communities, aggregating communities, and just say in this particular place. So while everybody typically now you have health centers giving and all that because of the cold chain, I can say I take this batch out, 50, whatever, and I'm going here today, and I pre-announced that, and then and all of that. The way they take it to churches, some churches and all that. Right now the federal government actually says, if you can assure us that you have a group of people in a particular place, come to us and we'll actually delegate people to go. That sort of thing, but there has to be some aggression and enlightenment around it. Now, the people in that program who take the vaccines, I said, it's been on for almost a year. Why are you taking your first dose now? It's like, oh God, I just don't know where to take myself,
someone called me a few days ago and said, I'm around here, where can I get the vaccination done? And this person is like a journalist.
I see the look on your face. I say how astounded.
Then I have colleagues. When I say colleagues, I mean journalists, not here, journalists who are running away from taking the vaccine. They're running away. Like that's the safety net. They're running towards away from the vaccine is where they should be. And I'm wondering what's going on.
So that's the thing. And sometimes at that position, maybe sometimes I'm almost like, really? So when you sit down and engage, for those who can be open enough to discuss their fears and all that, a good chunk of it is unfounded.
Yeah.
So they don't even have very strong conviction. Just like, I have this feeling that this thing is not.
Yeah, that's one. On the other side, there's the falsehood that came out. Oh, there's this doctor in America that is saying that it's fake. If you take it, then there's this text they were spreading on WhatsApp. I think WhatsApp is the greatest evil when it comes to fake news. Oh, there's this text that's spreading on WhatsApp that if you take it, you die within 2 years. So I told the person that said the last, I said, but people die every day now. It's okay. It's okay. Let's even, yeah, even if people die every day. So why is that? So they spread all this falsehood through social media, and people take it hook line. People are not even asking.
The deeper question, what are educated questions, if you like.
Yeah.
So die from what, why, what, and all of that. There's the conspiracy. There's all the Bill Gates conspiracy. There's all that kind of. There's the Tuskegee effect.
5G. The 5G that we're going to launch. The 5G that we're going to launch next in 2 days. They're testing it in 2 days. Yeah, on Thursday.
There you go.
The same 5G that at that time was.
The world's biggest
we still have
evil.
religious organizations still doing the faith thing.
I mean, it's. I usually don't like to dabble into religious stuff and all that, but Jesus Christ, it's a big disservice to the public that because you introduce and you take a power that should be reserved only for the most divine things, and you apply something that negates something that in very real time, such a large public health risk, you are actually negating, and because people don't debate the dogma. So if it comes from a religious perspective, it's dogmatic. There's no debate around it. So even extremely high educated folks that I know take it hook like if it comes from their section of the church or religion.
Yeah, and the religious leaders know that. So why are they not using it to push the message? Because many of them have to take the test, and I think some of them have taken the jab. So why are they not preaching it? Why are they? Maybe because of their initial, about it's fake. Now they've gone secretly to take it, and they can't come out to say.
Because they travel.
They travel.
They do all that stuff. So I'm very certain, and I know for certain, that a good number of them will take the jab and actually, do the test and travel and all of that. So again, not a debate I want to come and do here on radio, but it's really sad, and I think it's a big disservice to that thrust. And again, these are the kind of things, what are the low-hanging fruits that society can go after to turn this tide and get us, into double digits and get us, further along the line. 1 year on, we should be talking 40-50%. That's where we need to get to. So if you add people who have had COVID, whether they knew it or not, plus those who are vaccinated, you get your people with immunity. And we know that a lot of natural immunity exists in Nigeria because a lot of people were exposed and didn't even realize it. And for some reason, that helps us sort of not have the